Hi, I'm Rafat Fields, and I am kickstarting the first entry into my health and fitness journal that will appear on my personal blog and YouTube channel. For anyone where we haven't met yet, welcome to the journey. I am committed to doing a better job of sharing my journey this time around. And yes, I say this time around because this is the second time in my lifetime that I've embarked upon a major fitness transformation. Around 2019, I decided to have gastric bypass, which was a surgical intervention. And when I had that surgery, I was somewhere around 245, 250 pounds. And after that surgery, it was a very dramatic transformation. I came down to be at some points under 150 pounds, but more importantly, I really adopted a lifestyle of health and fitness. I fell in love with the process of weightlifting. And because of that journey, many things cascaded behind that. But I have a really good foundation and understanding of how fitness works within my body, at least the different levers that can be pulled, and how my body tends to respond to those changes. So, like many humans during the pandemic, during 2020 and the years following, I experienced regain of my weight. Now, this is a very complex story, one that I'm not going to fully lay out here and now, but I'm sharing this to say that although I am a gastric bypass patient, I am in that in between space of I'm much smaller than the heaviest phase of my life. But I'm also significantly from the most lean and the most physically fit window of my life. I'm somewhere in between. And I think that because of that, I am uniquely positioned to talk through some of the things that I am doing, the reasons why, not in the interest of convincing others to do what I'm doing, but I believe that it is helpful to hear how others are thinking about their journey, processing their journey, first of all, in case you fall into a category where you're experiencing similar things, so you know that you're not alone. And secondly, it helps to hear how others are thinking about it because it may trigger a question that you can ask for your own care team or some information that can at least put you on the right path of self-discovery. So that's why I want to do it. I know that when I was making my decisions the first time around, whether or not to have the weight loss surgery, some of the things that helped me most was listening and watching journals, like watching people who did video blogs talk through their experiences, what they were learning, what was happening, what challenges they encountered, and just all the little in between spaces along the way. And because I benefited so much from that, I want to do a better job of giving back to those who may be coming on this journey behind me. So, a couple of things that you should know, right? You should know a few things if you watch my journal, if you watch my blog around health and fitness. I hope you will receive this not in the lens of me bragging about all the things that I've done, places that I've been, but I have a very unique perspective. And you need to understand the lenses or the experiences that shape my lens on how I see things so that you can decide how you will apply the things that I say to your own journey. So first things first, it's important to know that I've worked in the healthcare industry for well over 20 years. I've worked for pharmaceutical and medical device manufacturers. I have sold many drugs that are related to interventions for cardiovascular disease, diabetes, as well as devices that track and monitor things like blood glucose, which is an important measurement for managing diabetes. This is important because that means that I have a deep level of exposure to scientific data over these 20 years. That means that I sat through many scientific sessions listening to world renowned cardiologists, endocrinologists, primary care physicians, and specialists all in between share evidence and data on the clinical interventions, protocols, and processes that impact patient care. So, when it comes to the concept of the healthcare system and agents that physicians and practitioners use to improve health within people, I have a very deep, layered understanding of those things that is always running in the background of what I'm thinking. So, very important to understand that. The next thing is during this journey of going on gastric bypass, another critical thing is I fell in love with this process of wanting to make physical movement part of my recovery process. As I was coming off of the post op surgical protocols, I took it upon myself to build in physical activity in a very meaningful way. From the moment that I was cleared by my surgeon to start walking, I started walking. And I didn't do it as exercise, I did it as part of post surgical protocol. And I think that that mindset really, really helped me flip a switch in my brain and helped me activate the transition from my former life, which was not very physically active, into adopting fitness and integrating it into my lifestyle. Because that surgery intervention required a period of recovery no matter what I did. And by blending the physical activity protocols into that recovery process, at least in my mind and in my story, it made it simpler to adopt a new lifestyle. So I think that having that major surgical intervention and then transitioning into new fitness routines really did make a difference. That specific process made a difference. So from there, there were two additional things that I think you should know about my story. One is I followed the journey of others who had had the weight loss surgery but made this really significant change and transition into fitness. And I studied and worked with one of those patients who became my coach. She became like a one on one remote trainer. And there was a time that I traveled for work. When I would go to Detroit, I would spend time with her and we would go work out together. I found her on Instagram, I think, and became so enamored with her journey of making such a meaningful transformation in her health and fitness journey after the surgery that I asked her to help me build plans and to coach me and to be alongside me as I started implementing this within my own story. So that one-on-one support from someone who had made that transition already was super helpful. And it was specifically someone who had had the same bariatric surgery procedure that I had. Very important. The next set of experience that's important is as I started finding success with that physical training process, I started deepening my support to help this transformation take root. That looked like things that I had started the process at a Planet Fitness type of facility, which, by the way, Planet Fitness is amazing. And I think it's critical that I started there because I don't know that I would have been as successful if I had started in another environment. We'll talk about that later. But I also transitioned my gym facility as my progress deepened. I found myself going to a lifetime fitness type of facility and signing on with additional one on one support, personal trainers who helped me go even further in my journey. And as I found success walking along this pathway, I decided I wanted to go study this process and be able to pull it apart and deeply understand not just having plans built for me. I wanted to understand the different levers of how you could build these plans and the effects that it would create on the body. Not necessarily to train other people, although I now have a credential to do that. I'm a certified personal trainer through the National Academy of Sports Medicine. I have the credentials. But for me, it was more about being able to deconstruct the process of how things worked to impact that physical transformation so that I could gain more mastery in being able to manage my journey independently. So I want you to understand all of those lenses. But wait, there's one more really key journey. As I found tremendous success with the training aspects, I decided that I wanted to step forward into a greater challenge. I evolved into training and competing in USA weightlifting as a master's level athlete, and that introduced a completely different phase of my fitness journey. From there, that's where you can introduce the impact of the pandemic and the world kind of going cuckoo crazy and having to rebalance all the things. And now I find myself in a place of significant drift from peak performance. And I'm going to put peak performance, by the way, in air quotes. Spend a little time with me. You're going to understand why. Everything is relative. So I would say that if you're measuring by things like body mass index, we'll call it that. If you're looking at the percentage of fat to muscle on the body, right? That's another way to look at it. If you're evaluating through those lenses, I would say I'm significantly from peak performance from those measurements. Now, as we embark on this new phase, I initiated therapy with Zepbound, which is Eli Lilly's GLP-1. And this process has been a journey all its own. I would say I am thankful for the training that I have had in my career to be able to understand the impact of this category of medication because it is not readily available to all who can benefit from it, my humble opinion. I happen to be in a situation right now where we're on my husband's insurance and his insurance does not cover GLP-1s for people like me. And I'm going to tell you a little more about my story. I'm going to be very vulnerable in case the anything here resonates with you. For this stuff, I want you to understand the inside of my journey. And my encouragement for you is to always find a primary care physician that understands who you are in your family history and build a deep and meaningful bond in creating a plan that works just for you. So take insight from me and my story, but always go back to your care team because that's who can serve you best when you're making decisions like this. But I will tell you a little bit more about my story so you can appreciate the types of questions you might want to ask. A couple of things. I have two beautiful boys. They are older now. My oldest is 14, and then I have one that's 10. In both of my pregnancies, I experienced challenges with my glucose. In my second pregnancy, I went on to develop gestational diabetes that was treated with insulin. And so I am very clear that based on my history of gestational diabetes and family history, that left unchecked, if I allowed my body to just maneuver on its merry way without significant intervention and course correction, my genetics put me on a very direct path to developing diabetes. The incident rate of those who go on to develop diabetes later in life, who once experienced gestational diabetes, is extremely high. So, just that fact alone puts me on a collision course. But the fact that I have significant family history, other members of my family who have diabetes, means that it is very likely that if I don't do something in my story, that's where I'm headed. So, in addition to the family history of diabetes, it's also important to see the drift in weight, the impact of weight. Without getting way too technical, metabolic syndrome, it's the clustering of conditions that can disproportionately affect communities of color. So if you think about things like hypertension, high blood pressure, high cholesterol, and our good friend diabetes. Well, I've already shared that diabetes is a very likely outcome in my future because of what I've already experienced in my past. The other conditions that we don't know, we don't get a crystal ball to see how our body is going to evolve, like when we get to our 50s versus our 60s versus our 70s, are things like cholesterol, because cholesterol can build and evolve over time. But one of the things that matters is that when you have diabetes, it doesn't start as full blown diabetes. It usually starts as something called insulin resistance or prediabetes. I'm trying not to get too technical in this introductory video. Here's what you need to understand. I am someone who does not necessarily have the quote unquote early warning signs for things like hypertension or high cholesterol. But because I do have the warning signs for diabetes, it is very possible that both of those conditions can weave themselves into my story at later chapters. And if that should happen, the risk isn't 1 plus 1 equals 2. It's more like 1 plus 1 plus the diabetes equals 100. So, knowing what I know, having had the privilege of sitting in all the scientific meetings with the world renowned specialists all across the world who are doing these research studies, who are presenting their data, and hearing, I can't even tell you, hundreds, if not thousands, of case studies over the course of my 20 plus year career. Here's what I know: the best thing that I can do to give myself the best chance of success is to keep my body from the trajectory of going on to develop the full blown diabetes, but certainly some of the other conditions that can compound and cause even worse outcomes. Things like a stroke or a heart attack, because of what the diabetes can do inside of the body with the blood flow. So rather than waiting for my body to continue on this progression, the course of developing more and more insulin resistance, and then eventually like having more challenges combating and regulating blood glucose, the best thing that I can do is to change and shift the trajectory that my body is on and bring it back to better maintenance and control of glucose today. And by introducing the GLP-1, what happens is we're doing it at a point where my body still has a little bit of response on the insulin, meaning that it can help. My body's natural production of insulin can still help us. Versus if we wait until the insulin resistance develops to worsening states, then you're introducing the medication at a point where your body can't help you nearly as much in its natural state. So, this is why understanding all the things that I understand and have had the privilege of learning over the last 20 years, I made the decision that when I looked in my labs this last time when my doctor ran them, I felt confident that we were definitely moving that train out of the station. We're moving out of the slowly but surely to the we're getting ready to emerge past that danger fast track zone to bad outcomes. So rather than waiting for those conditions to worsen or for an event to happen, I decided I would take the proactive choice of initiating the GLP-1, even even if my insurance doesn't cover it. I will tell you that the copay for these medications, when you don't have insurance coverage, is not for the faint of heart. Later in the blog, we'll talk about all the things related to the different factors between coverage and copays and what insurance companies have to balance. They're trying to make the best decisions that they can. But I think we have some questions as broader society that we should answer collectively to figure out how we can make the best decisions overall. And sometimes that means changing the lens of where the decisions are being made. But we won't talk about policy today. In this intro video, what I want you to take away is I'm just getting started on my health and fitness journey. These last few weeks have been what I call warm up, getting my body to reacclimate to the process in response to being on the medication. And here we are. GLP-1 is on board, physical fitness slowly but surely on board. And now I'm excited to share some of the tools that I'll be using in case it serves others. But mostly, I just want you to know that you can do it. You get to choose what success looks like for you. And there is no one size fits all program that exists, in my humble opinion. Everybody is, I mean, literally everybody is different. And it's so important to tailor the goals and then the program design to the human, and then create the support system around that. So I hope that if you're getting started on your journey, you are encouraged to know that every step you take towards change is good. And you get to course correct along the way until you find the place that is meaningful for you. I'm going to keep it light for this intro session. And then I'll say this, if you have any questions about getting started on your journey or just want a priceless pep talk, because those matter too, I am here. Feel free to send me a note, send me a virtual high five, and I'd be happy to send the same back to you. Bye.